Welcome back. We are answering your questions about the coronavirus with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. You can continue to text your questions. This person is asking, are there side effects after the vaccine? And if yes, what are the most common symptoms people see?
So usually the first vaccine, people will have some soreness of their arm, similar to like a tetanus vaccine. And then the second shot, a lot of folks have symptoms where they can feel like they have fatigue, fevers and chills, but those symptoms usually go away within 36 hours. And then you're kind of just back to your normal day-to-day activity level.
After the second shot, can you still carry the virus and give it to someone else?
So because the vaccine is not 100% effective, folks can still acquire SARS-CoV-2, still have COVID, despite being fully vaccinated. And we estimate that to be maybe 1 in 20 people.
This next question is, if I did not have a reaction to the first vaccine, is it safe to assume that I'm not going to have a reaction to the second dose?
We're actually not sure. We know that the second dose, most people have some sort of some symptoms from the vaccine, and we can't predict who does and who doesn't. I think it's best just to assume that you might have some sort of a little bit of side effects after that second dose.
This person is asking, can friends who have all had the second vaccine dose socialize together?
Oh, I think that's a dream for a lot of us. But right now, because a lot of friends, right, they are not part of the same household. They probably reside with other folks that do not, or maybe are not immunized. And so it's still very risky. So it makes sense to wear masks when you're together. Can you make a safe outing outdoors? Distance dinner of sorts? Probably.
This person is asking, after having 2 vaccines, is it still necessary to wear 2 masks? And how safe is it to fly after getting 2 vaccines?
I think of the vaccine as yet another level of protection for you, just like wearing a mask or eye protection. When it comes to flying, you still need to obviously wear masks because it's a mandate, but you still also have to do hand hygiene, and it protects you a little bit, but doesn't make it completely safe. And in terms of wearing 2 masks, again, you probably just need one well-fitting mask that has a couple layers. But if your mask is only a single layer, then it makes sense to do a double mask.
This person says, my husband does not have the vaccine, but I have. Should we be wearing masks at home?
So in that scenario, I think a lot of folks who are maybe in healthcare or over 65 and one person is getting vaccinated, it almost feels like, you're doing as much as you can to protect your spouse that's not immunized. You don't necessarily have to wear a mask indoors. The key thing is that you continue to observe the 3 W's, not going out too much. But if the immunized person has been exposed, then it makes sense to wear a mask at home to protect your partner from not getting COVID in the event if you convert.
Because again, we don't know whether you can possibly still carry COVID even if you've got the vaccination.
Yeah, because again, it goes to the point that it's not 100% effective. You can still get it, but maybe it's even a milder form. And we know that folks who are asymptomatic can still pass it on. So for instance, if I were to be exposed at my work, I would wear a mask at home, even though I've had the vaccine.
This person is asking, is it safe to eat out at a restaurant, inside a restaurant, outside the restaurant?
Oh, with eating in a restaurant, it is really dependent on a few things: how crowded it is and how much ventilation there is. I think all of us miss that dining experience, but it's going to be different. Again, if you can, not necessarily now because the weather's too cold, but eventually when it gets warmer, dining outdoors is safer. Can you go to a restaurant that's not too crowded, right? That's in that 10 to 25% spaced like at least 6 feet apart, probably, as long as you're not eating in a big party, right? You don't want to be a party of 10 or more with people that you don't really, that's not in your bubble. That places you at risk for possibly getting exposed to SARS-CoV-2.
All right. Thank you so much for taking the viewer questions as well. We so appreciate that. We are going to post all of these videos in the Two Wants to Know section so that you're able to get your questions answered. We've got a lot of the same kind of common questions, so go back there and watch those videos and make sure that you get those misconceptions busted.